The following is a production of Texas Lutheran University. For more information, please visit tlu.edu.
And it is my pleasure to introduce Dr. Jennifer Sigsbee Gonzales. And she actually went to medical school in Guadalajara, Mexico, then came back to the States and actually did her residency in internal medicine at UT Harlingen. And I'm going to turn it over to her. Thank you very much. Am I wired for sound?
Mic check.
Okay, good. I'm not really one of the stuffy kind of presenter kind of things, and I kind of just talk off the cuff. And so, if you have a question, so I believe there's some question and answer afterwards. But what I actually did is I didn't really make a presentation about any specific topic, but the fact that Texas Lutheran was such an instrumental part in getting me, opening up my life and getting me to success, I kind of don't want to say it's memoirs, but when I was doing it, I was like, my goodness. But it's all the different things that I've been through that Texas Lutheran made possible for me. And so, if any of you remember, because some of y'all are young enough to remember this story when you were little, but I have a toddler at home, and so there's a book by Dr. Seuss called Oh, the Places You'll Go. And so I kind of used that a little bit to start this. I'm a graduate of Texas Lutheran class of 1996. I was the last graduating class of Texas Lutheran College. That following August, it became Texas Lutheran University, and it's still very much hard for me to think of it that way, because for me it was always tender loving care. And now I don't know what you say with TLU, but anyway. Okay, so Oh, the Places You'll Go. And so for some of you that don't remember, there is a little snippet that I think is really indicative of how we've done our lives. And it says, congratulations, today is your day. You're off to great places, you're off and away. You have brains in your head, you have feet in your shoes, you can steer yourself in any direction you choose. You're on your own and you know what you know, and you are the guy who will decide where to go. And for me, that was it. I was on my own, I was off to college, I knew that I wanted to go into medicine, I knew that I wanted to do that from very early on, and basically it was really up to me to make it happen. And then I met this incredible group of people who helped me on the right path and make it happen, and you'll see that. One of the things that made me choose the title as well is because of my education here and the things that I've done, I've been fortunate enough to broaden my horizons, and it started all here with Global Perspectives. For any of you that have to do your liberal arts part along with your sciences, I had to take Global Perspectives with Dr. Bidrich. And we actually made a journey down into Mexico, down into pretty far into Mexico. Some of the students went as far as Cuernavaca and Querétaro, but we went to quite a few of the different areas down deep in Mexico near Guadalajara. And if you've never been deep off into Mexico, then you really don't know what Mexico is all about. But these were some pictures that we took during our Global Perspectives. So that was one of the places that I got to go. And then lovely lab. For some of you who might have experienced this, I don't know what levels you are at, but this was Dr. Hettinger's lab. And basically we're isolating DNA and documenting it as we went because we were doing projects for our senior seminar. And so these were some of my favorite pictures because we had many discussions about what we thought DNA really looked like. This was my senior seminar class. And I would have to say we were discussing over lunch how successful, I don't know of anybody in the picture who hasn't made a big impact on their environment. But we have doctors, and we have scientists, and we have researchers, and we have doctors, and we have dentists, and we have a gentleman who does forensics. And so it's a wide, but all very successful group of people. And then I graduated. And that was a wonderful day because it was very hard fought. As Dr. Squires will tell you, I was not one of the students that kind of just coasted through here. I was a lab rat and a TA, graded many papers in my day. And I also was a proofreader for the LSL. I worked the phonathon and held down a not supposed to be full-time job in the ER at GBH, now which is GRNC.
60 hours a week is not quite full-time.
No, but I got here, and I have to really say that I owe it all to the professors and friends that I had around, because they were the ones who made sure I was in class and made sure that when I was having a bad day, they knew about it. In the summers, I would stay at Dr. Hevinger's house, so I didn't have to pay on campus rent. Actually, they kind of discouraged you to stay on campus, so there were a lot of things that helped me get to that day, and by no means was it for lack of my professors helping me in my life. From there, I went off to college, medical school, sorry. I was one of the students that, because I worked so much, I probably didn't have the best GPA. It was good, but it wasn't good enough for me to get into medical school up here. And rather than crying my Rice Krispies, I decided to do something about it. And I had been given an opportunity to do some missionary work in Mexico, and started to kind of pick up on the language, and didn't really know how life was going to treat me, but I knew that come heck or high water, I was going to be a doctor. I didn't care how I had to do it. And so I threw myself in full force. And actually, it was probably the best experience I've ever had in my life. It took this naive little girl out of Cuero, Texas, and it showed me really a wide variety of people, different cultures. I learned Spanish. I can speak, read, and write it now. All of my classes, though, were in English. Though it's a program that the New York Medical College sponsors, and the goal is to get students to go back to New York and practice up there, because it's such an underserved area. And so basically, I went always with the intention of coming back home, but it was a means to an end. And like I said, it was probably one of the best decisions that I ever made. I'm holding my diploma, but one of the wonderful things that I got to do while I was there, and you may not recognize the lady that's standing next to me, but her name is Dr. Antonia Cuello Novello, and she was the first Hispanic Surgeon General of the United States of America. And she was actually the godmother for our class, or the sponsor for our class. And so had I not ventured away, I probably never would have been able to meet this lady. This is some of my rotations when I was in Mexico. I worked in some of the Social Security hospitals down there. Interestingly enough, not to get political, but the type of medicine that's coming is a lot like how they practice in Mexico. In Mexico, there are multi-generations living in one home because of the medicine style there. One person living in the home that's working, everyone in the home has insurance, and it's through their Social Security program. So that's why you have the children and the parents and the grandparents all living in the same home, but they all have medical care coverage. Granted, it's wonderful for basic level things, but as time goes on and you have more illnesses and you become sicker, your resources are limited. And so it was very rewarding. I got to take care of a lot of patients down there. I got to work in some of the neighborhood clinics where they thought a Band-Aid was like giving them gold. And it really opened me up as a person, and got to be very understanding of language barriers and different cultures and different socioeconomic levels, because in Mexico, they're just like here. They have the very poor, and they have the very wealthy that go around with bodyguards. And I was able to see all the dynamics between. Also would go and make home visits and learn about their culture in that manner. Almost like an exchange program, sort of. I also was able to meet Colin Powell. We had a conference for the American Medical Students Association, and he actually spoke there. And as a representative from my university in Mexico, we were able to go there. And I actually did get to meet him at a conference. And so had I not journeyed abroad, that probably never would have happened either. And then from there, I made it to New York. And this was a bittersweet time. It was happy, and then it was sad, and it was scary, and it was difficult. And but the education that I got while I was there and the places that I got to work were instrumental in making me what I am now. And so the different pictures that I have, of course, at the top, that was a picture that I took of my friend and I who were there. We went to go visit the Statue of Liberty almost as soon as we arrived, and so, of course, the beautiful Statue of Liberty and the Twin Towers. And then the fireworks were actually from our apartment. We lived in the the tip of Brooklyn, overlooking the water where the Statue of Liberty was and overlooking lower Manhattan. And so they always shoot the fireworks off at the Statue of Liberty, and so we stood on our apartment building, the roof of our apartment building, and actually got to watch everything here. that comes into play later because I could stand on that same apartment building and watch the fires burning from when the World Trade Centers were attacked. This is one thing that I found was very important. I have a lot of pictures from when I was there, and I'll tell you a little bit about that day. I don't talk about it very often. It was a very scary time for me. Still that 98-year-old girl from Texas up there all alone. Didn't have any family there. I only had my friend from California who was pretty much as naive as I was. We were living in an apartment closer to the water than the hospital was. And the neighborhood that I lived in was actually the little Dominican neighborhood. And I don't know if any of you have been to Brooklyn, but the way things are situated in Brooklyn is like you have the Russian population here, the Dominican population here, the Chinese, the Jewish, that sort of thing. And so when you walk through the neighborhoods, because I didn't have a car there, the stores, the names on the store would change, the language on the storefronts would change. You would hear different languages as you were walking, the people on the bus would change. And so this is where we lived, right here in the Dominican neighborhood. It was 1 block up from Lutheran Medical Center and about 6 or 8 blocks from Maimonides. And I was actually assigned to Maimonides. Now the reason I got to go there was because in Mexico, they had a program to where if you worked really hard and you were at the top of your class, you got to come back to the States and do your clinicals. And so I've never been deterred before. And so I was in that top of my class, and they took the top 6, and so I got to go to Brooklyn for 6 months. And that 6 months that I was there is when 9/11 happened. Now that day we had just been in morning report, and I was at Maimonides, which is a Jewish hospital, and I had never really been exposed to the very, very strict Jewish population. The gentlemen that would dress in traditional garb, they wouldn't speak to me because I was white and not Jewish. So I had to get used to all of those things. They very much kept the Shabbos, where on Friday night they didn't do anything until Saturday night. The ladies would not even push the button to get on the elevator. If the elevator doors opened, they'd walk on, but they weren't going to push the button because they're not allowed to work. So that was a very interesting time there. And we had been down in morning report, and we had grand rounds or whatever, and about 8:45 we were going up on the elevators. And about 8:48 we popped out on the top floor of the hospital, which is the cafeteria, and it's all glassed in, and it's a complete view all the way down to Lower Manhattan. It looks over a cemetery, which all you see are the trees, and then you see Lower Manhattan. And when my friend and I got off the elevator, we heard people talking about a plane. It hit the tower, and they thought maybe that it was a crop duster out of its place, and they were really worried and concerned, but they didn't really think anything of it. And so we're standing there, and we're watching this tower burning, and I don't know if it was Fox News or whatever, but there was a TV on that was actually had a close-up view of the towers. And so we're standing there watching, and you hear the newscaster say, "Oh my God, there's another plane." And we're watching, and we were on the side that the fireball came out of the second tower. And so if you see that news clip, all that time, I was on the side watching that fireball come out. And I really don't remember a whole lot after that, except that we all freaked out, and we all got down from the cafeteria. We went to our assigned places to try to figure out what we were going to do that day. And at that time, I was doing a pediatrics rotation. The secretary of our department, her mother actually had sprained her ankle a few days prior, and she was at home. Well, the interesting thing about this is her mom worked on the 91st floor of the second tower. So her mom wasn't at work that day, but her mom's friends were, and they were gone. And what hurt me the most, or impacted me the most, was we got home, our apartment was filled with ash. There were financial papers floating everywhere in the water, on the streets. We weren't allowed, all the subways had been shut down, all the buses had been shut down. We were basically isolated in our little area. TVs didn't really work well, our phone service didn't work well. From what I understand, the telephone company building was across the street and the basement flooded, and so our phone services went out. I was, however, able to make one phone call home, and I spoke to my now husband, he was my boyfriend then, And he had been watching it and wanted to make sure that I was okay. And then that was the last I got to talk to him for about 2 weeks. But he did know that I was fine. The way I was involved, instead of just witnessing it as a bystander, is our hospital basically went on shutdown mode. All the streets around the hospital were blocked off. You had to wear your badge and your coat everywhere that you went, and it was checked every time. They didn't just look at you and make sure they made sure your picture matched your face. And then we started taking care of some of the non-urgent injuries. Firefighters with smoke inhalation, people that had stuff in their eyes, a lot of the upper respiratory, they would go into asthma attack from all the ash and gas and just junk in the air. And so lots of corneal abrasions, lots of foreign bodies in the eyes, lots of inhalant injuries, some lacerations and things of that nature. Nothing, don't kid me, I was not at ground zero. But we took care of a lot of the people that did go in to try to help. But those hospitals were overwhelmed with all the acute injuries. And so we took care of those first responders and those patients that were in the outlying areas. The things that haunt me still are, I didn't have a car, so I walked everywhere that I went. And walking to the grocery store, you started to see all of the papers on the wall. Just plain old paper like this with people's photos saying, I can't find my husband. If you find him, his wedding ring set has our initials on the inside. Or I'm looking for my daughter. It was her first day at work. And I remember their names, and I remember their faces, and those kind of things. And it's very surreal. It's almost like you weren't there. I try to talk about it that way anyhow. But the thing that impressed me the most was, within just days, and you can see the date on my picture, all the people in my neighborhood, I had been there already several months and really never met anybody. In the evenings, they would come out and sit on their stoops in front of the brownstone and they would talk. They didn't become the Chinese, the Dominicans, the Pakistanis, the Jewish. Everybody came out and started to become American. And one of the first things that they did was they went out in the street, and probably this is not the best place for an American flag, but they put an American flag in the middle of the road to symbolize that they were Americans and that they were standing together. And so there is one picture that I could not find that I wanted to put in here. But on the last day, when I flew back home to Texas, which was probably 2 weeks from this photo taken, there was a picture of me. I stood on top of our apartment building and took a picture, and it's still, you can tell by the date, it was almost a month later, and there was still smoke just billowing into the air from ground zero. And it's hard to imagine, but I could not find that. My daughter likes that picture for some reason, and she's fascinated with it. She's 8, and so she has it somewhere tucked in her room in her memories. So, but that was probably, like I said, it taught me a lot about the human spirit, and it taught me a lot about how to deal with people in times of crisis. But it also taught me a lot about being together. Your culture, it doesn't matter what you speak or what you look like. If you're here for a common good, and so that was very, very much a meaningful time for me. From there, I graduated from there, and I transferred to New York Medical College. I did rotations primarily at Sound Shore Medical Center in New Rochelle, and that's when I knew that I wanted to be an internist. I did a rotation, and it was just very cerebral, you had to look at the disease and know everything about it, and it was just so interesting how things interacted and how all these puzzle pieces were coming together, and it was exciting. And I did some surgery too, and we delivered some babies, but the internal medicine rotation that I did was that's what hooked me. And then at Westchester Medical Center, which is the major teaching hospital of the I also did some rotations there. I graduated from there, and then I started my residency. I got home from New York, back to Texas. I transferred down to start my residency in Harlingen. And I was the second class of the UT Health Science Center in San Antonio in an effort to eventually develop a medical school down in the Valley, which is a very underserved area. Started a residency program down there affiliated with Valley Baptist. Now, right now, Valley Baptist has 2 residency programs. They have a community-based program that they sponsor, that's family practice. They have the internal medicine program through the Regional Academic Health Center, which is obviously a university-based program, but we train in the same facilities. And one of the reasons that I got to go down there was the draw was because I was fluent in Spanish. But the second draw was I got to do a lot of research. And the research started actually right here in these walls, preparing for senior seminar. As much as we didn't want to, as much hard work as it entailed, that actually was the catalyst that started the whole research thing for me. And the very first time that I was ever published, because Dr. Squire said, you are going to leave this place published, was when we got to be published in the proceedings of the senior seminar. And so that actually looked really good on that resume. Well, I continued my research work down in the valley. If any of you guys know King Ranch or the Clayburgh family, they actually donate a substantial amount of money every year to our program in Harlingen for us to do research that is primarily centered around issues that the patients face in the valley. And so if we do research, then we get a stipend, but we also, you're named a Clayburgh Scholar. And so of course every year that I was there for 3 years, I did research. And that research took me interesting places. I got to present at the Texas Academy of Internal Medicine meeting. I was able to present several posters at the American College of Physicians annual meeting, which is our nationwide meeting, and won a few awards here and there and that kind of thing. But the research spark started here, and it just kind of carried on. And so that was my class that we graduated. That was after our first year. Now this little thing right here, I have to tell you, I'm going to leave that up there for just a second. But before I get to the very end, one of the things that I do apart from here is apart from my private practice is I do hospice medicine too. And so what I did is after I graduated, I moved back home to Cuero, and that's where I grew up. It's probably not the place that I always wanted to be, but I made a promise to my mother and father-in-law that we would move home and help take care of them. And so it's been a blessing because you never know what's going to happen, and actually they have started to need our help more and more. And so now we're home and we have 2 kiddos. I have an 8-year-old and a toddler. And when I moved home, I was the only internist and the only young female practicing in Cuero. And so I had to get some tough skin real quick because I was encroaching on territory and they didn't want an internist there because they never had one there. But I had to be at home, and so I basically just hit the ground running. And I was actually in private practice for full-time for about 5.5 years. And then my dad got sick, and he got sick all of a sudden. And he was healthy in August, and by September he was in a coma, and by December that year he was passed. And he had heart disease, and he didn't take care of himself, and he was one of those guys. He was an engineer. He retired from Houston Lighting and Power when Reliant bought them out, and he moved to the country. And he was in that gap where he wasn't Medicare, but he didn't have jobs. He took retirement, so he had to have private insurance, which was really expensive. And so basically he let things happen. He felt fine, but he didn't realize what was happening inside. And he ended up having heart surgery and then complications from that, and then he passed. And after that, my husband and I decided that we needed to try for at least another child. He thought maybe it would take my mind off things if I had another child. And so Elizabeth was our only child at that point. And then we got pregnant with Maria and had Maria. And dealing with the loss of my dad, who was probably my best friend, apart from my husband, and dealing with a new baby, I decided that really and truly, at the end of the day, the only thing that really matters is your family. And if I was to be gone tomorrow, they'd find another doctor. If your professor was gone, they would find another professor. They'd be sad, but they'd find another professor. But your family, they would experience a tremendous loss. And so I had always been doing hospice medicine. For some reason, I've always kind of been that person that I'm doing the end-of-life care talk. And so I worked with Hospice of South Texas now for probably 7 years. But about a year and a half ago, I got an opportunity to work with them full time. And basically what that entailed was, in addition to being board certified in internal medicine, I sat for my boards for Hospice and Palliative Medicine and passed that. And then I was hired by Hospice of South Texas full time. Now, Hospice of South Texas is the only non-for-profit hospice agency in South Texas. I don't know about your territory up here, but in Cuero, Victoria areas, it's the only nonprofit. We cover an 11-county area. We have 96 full-time employees, and we see about 800 patients per year. That's an average. Average census is usually about 130 patients or so. And what my job is to go into the homes and help the families and help the patients understand end of life. And for some of you, I know that when I was sitting in your chair, the end of life never really even fazed me. It never even crossed my mind. You think it's so far remote and you don't think about it for your parents. But I really struggled after my dad passed away. And it was my way of therapy for me was to help other people. And so basically what I started doing at that point was working there full time, and then my private practice kind of became part-time, if there is such a thing. But hospice has been very rewarding to me. I do get to go into patients' homes. I've counseled a lot of families who their parents are dying and their children are my same age, older than you, but still I think I'm very young anyway. And so, you know, that's helped me give back. And everything that I've learned from here and all the places that I've gone has really made me into who I am. I have these flowers up there, and I apologize because they're really badly taken, and that's the really ugly carpet that was in Emma Fry 14 years ago, whatever. I forgot actually what those flowers were about when I was looking through pictures a couple of weeks ago, but as obsessive compulsive as I am, I marked on the back, and Dr. Hedinger picked those flowers for me on graduation. And she brought them and set them outside my door in Emma Fry. And so, for those of you in this room that actually got to meet her or be blessed by her teaching, you're so very fortunate, because when I told my mother that Dr. Hedinger had passed, her text back to me was that she felt very sorry for me that I had lost a great mentor, and that she thanked her for making me into who I am. Because we joke and say that, you know, my mother birthed me, but Texas Lutheran is the one who really made me into who I am, and especially the science department. You know, there are so many names but you know, Dr. Jonas and my research with him, and Dr. Squires and lab and dog lab that still haunts me to this day, and Dr. Hedinger letting me drop off the frogs at my tank back home so we didn't have to kill them. You know, I have memories that I could just talk about for days. And I'm so fortunate to have been walking these halls and sitting in the chairs that you're sitting in, because you won't realize it now while you're sitting here and you're wanting to leave and you don't want to do your homework and you're tired and it's the weekend. But a few years from now, you'll look back and you'll realize what a wonderful place this was and how they made you into what you are. So for success, that's where I'm doing hospice full time. But that's my biggest success right there. And that's my husband and my daughter Elizabeth, and then baby Maria, and that was Christmas last year. Because honestly, they're the people that make every day worth it. And then my husband always tells me this whenever I have moments of doubt, because it comes, and it will. But if one advances confidently in the direction of his dreams and endeavors to live the life which he has imagined, he will meet with the success unexpected in common hours. And he has set me that, I don't know how many times, to remind me that even when outcomes look bleak, and even when I don't think that I can do it, that I can stay strong, put one foot in front of the other, and that it'll all come out in the end. And that's exactly how I approached it. When I came to Texas Lutheran, I was just this little kid from Cuero, didn't have money at all. Thank God for a scholarship. Thank goodness for the admissions department telling me what I needed to make on my ACTs to get that scholarship. And then them taking me under their wing and making sure that I was in the teaching department and I was in the lab and that I needed help and that I had a place to stay, and just raising me, essentially, just making sure that I was successful, because ultimately that's how they measure their worth, is how successful the kids are that they've had in their classes and that they've raised. And so, just like I told you at the very beginning, and I'm going to say it again, so you have brains in your head, you have feet in your shoes, you can steer yourself in any direction you choose. You're on your own, and you know what you know, and you are the guy who will decide where to go. And so that's why I chose the title, Oh, the Places You'll Go, because walking these halls, you are just in for a lifetime of just success.
Questions? Right here.
Yes. You did part of your medical school in Guadalajara and part of it in New York City?
Yes.
Okay.
Basically, it's a study abroad program. They used to call it the Fifth Pathway, but they've got a different name for it now. I don't exactly know what they call it. I think they call it pre-internship. But basically what it is New York Medical College. That whole area is very underserved, especially in the inner city and in the Bronx and that sort of thing. So what they're trying to do is they realize that there are certain people that kind of fall through the cracks. Like I said, my GPA wasn't bad, but it wasn't good enough to get me a shoe-in into any of the schools here in Texas. Part of it was my parents moved out of state whenever I was in school. They moved to Arkansas, which has one school. They accept 105 students per year, and that's it. And so that messed up my Texas status. And so I became that 10% that came from abroad, India, Pakistan, wherever. I became in that little 10%, and it's very hard to get into a Texas school unless you are like 4.0 to the max. And so I just couldn't do it. But I didn't have a choice. I worked very hard. They can attest to that. I worked at the hospital. I worked by other things, because otherwise I wouldn't have had an education. And ultimately I knew I would get there. But I had done some missionary work abroad, and so I wasn't afraid of going down there, and I knew a few others that had gone before me that were classmates, and they were successful, and so I didn't have anything to lose. And ultimately I was going to get to my goal no matter what. And like I said, I used to apologize for studying abroad, but I don't anymore, because there's so many things that I would have never been able to experience or do. Or I have the fact that I'm fluent in Spanish. I never would have been fluent in Spanish staying here, but I got to do that. And then what you do is you do your first 2 years that are in English down there. Then when it comes to the clinical years, if you are at the top of your class, then you transfer right away. Otherwise, you stay down there and you work in the hospital and the clinics, of course, in Spanish. But that helps you perfect your language. And then you graduate from there, and then you transfer to New York Med. And then when you do get from New York Med, then you get a diploma from there as well. And then you just come into the residency match just as if you never left. You just had to work a little harder. And a lot of times what I've been told is some of the non-traditional students that do a Fifth Pathway or a pre-internship like me, they usually work harder because they wanted it bad enough. And some people that were spoon-fed from the first day, they don't have that drive to work hard, to make the grades, to pass the boards, to get to where they need to be.
I might say she kind of was the trendsetter down there. She was the president of the International Student Association. And Dr. Wasman and I, after she graduated, we went down, they brought us down there to develop a memorandum of understanding, and they said, we want more of these kind of students down here, and as a result, we've been very successful with placing multiple students down there. Gabe Zuniga, he told me when he came back through the same pathway that he delivered close to 200 to 300 babies.
You start working in the clinics your very first semester, and everything down there, they call it by lottery system, but basically what it is the harder you work, the better your grades, the better clinics you can choose, the better classes, the better you get to come to New York and do some rotations. And so basically they don't care, they want you to succeed, but if you're going to be sitting in the last row and you're not going to pay attention and you're not going to work hard, you're not going to succeed. And so they really want to focus on those students that really want it bad enough. And so you start clinic for your very first semester before you know anything about anything. And it just continues and builds and builds. And you get to do a lot of things that ordinarily you would not be able to do in the United States because there are so many restrictions.
Also, I might add, you might comment on your work at the hospital as an intern and developing you as a physician with your internship experience here.
I don't remember how far along I was in my education before I started working at the hospital. But I started off working in the ER as a tech. And actually, it's embarrassing to say, but I will admit it, the reason I was a tech and I was not a ward clerk is because I did not pass my alphabetizing exam.
Oh my God.
The Saint Clairs, you know, where do you put it? Do you say Saint and spell it all the way out, or do you just do ST period? And I asked them about that, and they said, well, if you're not sure, then anyway. But it actually was the best, because I would have never liked to be a ward clerk. No offense if anybody in here is working there, it is, but I just could never, I need to see people. I don't want to push papers. So actually, I started working in the ER, and I would work there nights and go to college in the day. And I worked the weekends, and I started off, they knew that I wanted to go into medicine. They knew I was excited about it. And so one of the attendings that was there was very much into letting me do things. I learned how to draw blood, start IVs, do pelvic exams, sew people up. You know, we'd go behind the curtain and he'd say, okay, this is what you're gonna do. And you know, and all of that was just totally invaluable. The other thing is you start to kind of figure out, do you really like this or do you not like this? And then you also start to kind of form that differential diagnosis in your head. It's like you see a patient and you see these symptoms and you automatically start to think like medicine, and it kind of grooms you that way. There were people that I worked with that never ended up going into medicine, that they knew that wasn't going to be their calling ultimately. But for me, it was the more that they wanted to show me, the more I wanted to do, the more, and so by the time I got to medical school, I knew how to do all those things, draw blood, start IVs, the whole 9 yards. Well, when I was down in Mexico, the top 4 that went to New York, the 2 girls that were tops in the class were book smart all day long, but my goodness, practical skills, none. Didn't know how to do a blood pressure, didn't know how to start an IV or draw blood or any of that kind of stuff. And so for me, I was able to teach them that. And the only reason I was able to teach them is because I had all that experience at GDH. The blessing of working there was I worked really hard and I stuck with it. And so all through medical school, I come home summer and winter break and I come back and work the whole time. Finally, whenever I got to a point where I was going to start residency, then I had to actually leave. But I ended up working there for over 8 years in the emergency department between college and then medical school, and that was the groundwork, the foundation for actually the practical things that I do every day in my job. There are still other doctors that I work with that can't draw blood, and they don't know how to start an IV to save their life. And so, you know, I still use those skills every single day.
And she would get off work at 7 o'clock. Dr. Hedger would buy her a double coffee, and she sat in general physiology at 8 o'clock and stayed awake for the whole time.
I lived in Emma Farrar right there in the greenhouse is what I looked over, and she'd be like throwing rocks at my window, you know, if I wasn't in class. You know, I mean, that's the kind of place. One of the things is when I was going to go off to college, I didn't want to go far from home. My husband and I had already been dating for a couple of years, and I knew that I was going to marry him eventually, and so I just really didn't want to go that far. You know, my dad lived far away, my mom had my brothers to attend with, I had 5 younger brothers, and so I really just didn't want to go that far away. So I applied to UT, and I applied to Texas Lutheran. And I really don't know what got me to apply to Texas Lutheran, but somebody brought me on campus and it was like, wow, it's cool, it's small, and I think I would be okay here. Well, anyway, I got accepted at both places, and then Texas Lutheran came through with a scholarship, and that sealed the deal. Even though ultimately it was more expensive than UT, I guarantee you I would not be the person I am had I gone to UT. I would have been lost. I don't even know I don't know that I would have been successful in what I wanted to do, because you just have that close-knit family. We care about you. If you're not in class, we're going to find you. you can't hide kind of thing, you know, and if you have troubles, they're available. And, you know, I mean, where do you go where you have the home number for your professor, or you can just drop by any time, or they're in their office and you just walk in and you don't have to make an appointment. You know, it's just a phenomenal experience for me. And so I guarantee you I would not be the person that I am without what I started here, definitely.
And this senior seminar class, we were talking at lunch, and their senior seminar class, or hers particularly, I think we have 10 doctors out of 14, and those are MD, PhDs.
Dennis, Andy Surger in the back, he's a geologist. He lives back up in Oregon, and he does lots of things there. Wendy Curry's in front.
Wendy Curry is married to Miguel de la Garza, who's an anesthesiologist. She went to Southwestern Medical. She was a biology major. They have 2 kids.
And Anita's between you and
Michael Kent is an orthopedic surgeon. He was on TV. He had some kind of show. He's an orthopedic. Molly Thorson has a PhD in neuroscience from Vanderbilt. Mike Wenzel, married to
Albright. She's married to Chris Warbeck, and she's an oncologist
medical doctor
in Austin. Yes.
Finished first in her class.
Yeah, yes, she did. She graduated from me, and she did the military route for medicine. And she actually, I think she went into the Air Force, if I'm not mistaken. And so she was around, and strategically, she had a child every time she was going to be shipped off. And then she retired. then she retired. And she and her husband and their 3 children live in Austin now. That's what
This is Miguel de la Garza. He went to Southwestern Medical and married Wendy. And they're in Florida with 2 kids. That's Allison McDaniel. What is Allison McDaniel? Graduate school, I think. Anyway, we have 10 doctors out of this class. This is a very close senior class. You guys are probably tired of seeing Dr. Leibnitz's red ink on your papers.
Pencil.
It makes Dr. Jones and I's job a lot easier, because then we can be the good guy, he can be the bad guy. But your first publication, she said, will be the proceedings. What number are we at now?
21 or 2 or something like that.
And the thing of it is, you know, it doesn't matter if you're going to grad school or medical school or wherever, or law school, wherever you're going to go, because you never know. We had a few oddballs in our class that went off and did something else completely unrelated to science. But that is a publication, and you put that on your resume, because I guarantee you there will be other students that come along that have never published. And so when they see that you published, oh wow, that is a big deal. And you won't realize it now, but later in life, that's how you're measured, especially in the science field. Do you have any publications, any research? And now I've been published, including senior seminar, like 3 or 4 times. And so that's not majorly impressive compared to people who write textbooks and things of that nature, but for me that's pretty good, you know, because I'm not a professor, and this was all done during my medical school and residency years. And so, and then when you do things like that, you get to go to neat places. And I didn't have time to include it in here, but one of the meetings that I got to go to was actually in Toronto, and I got to present a case. I had a patient, when I was down at Valley Baptist, I had a patient who was a young male, and I want to say he was in his early 20s, and I was doing regular clinic, and he walked past my door, and I looked at him like, oh my gosh, that's an AIDS patient. I mean, he looked gaunt, lymph nodes out to here. He just had that look. And down in the valley, we have quite a few HIV patients, and I don't know if it's because we have a clinic, and so they just come out of the woodwork, or if it's just because it's more prevalent there. But this gentleman had been having high-risk behavior with a known HIV-positive male. And he had been having diarrhea, and he had thrush, and he had lymph nodes out to here, so everything pointed at him having HIV. But they did the ELISA test on him, and it was negative. 6 months later, they repeated it, and it was negative. And then the day that I saw him, he came walking past, and I'm like, I've never seen him before, and I'm like, this guy has HIV, he's gotten AIDS, he looks awful. They did the ELISA that day, it was negative, and I asked them, for grins, we're a teaching hospital, get a viral load. And sure enough, his viral load was out crazy. I mean, it was, I don't remember, it was in the million copies, several million copies. So he was HIV positive, but it was a false negative that was coming up on our test. So basically, that's scary, because if you have HIV, you want to know you have it, because now you get on meds, and a lot of times your viral load completely goes to zero. Dr. Casper, who was in Victoria and now practices here in Seguin, he has an HIV clinic, and he's got lots of patients that have been on HIV meds for 10, 15, 20 years, and you honestly wouldn't know that patient from anybody else. They look healthy, they're living a normal life, and that sort of thing. Well, anyhow, because that was such an oddball case, I got to present that in Toronto. And the benefit of that is, number one, I got to present it at an academic meeting, and that was for my professional society, American College of Physicians. But the added benefit is I can take my family along with me. And so I wasn't able to put the picture in, but basically what my thing was is, you're a lifelong student. And so my 8-year-old and I, because I didn't have Maria yet, but my 8-year-old and I went to the Ontario Science Museum, and it's this huge place. And we played with this electric ball that I put my hand on it, and my hair stood out to here, and her hair stood out to there, and we got to learn all these neat things. And so if you have that now, you get to pass that on. And if you don't have that foundation, you don't get to do those fun things. So
I would like to give you, from your heart, the best advice you can give these students right now.
I guess 2 things. Always keep your goals in mind in whatever you do, because everything you do affects how the outcome is. And never, ever, ever doubt yourself. If you want something and you want it bad enough, you'll get there if you just work hard. I'm a living testimony of that.
Thank you very much,
Students at TLU engage in high-impact educational experiences that include civic engagement, aesthetic expression, critical thinking, and a focus on intercultural knowledge in a community that welcomes the interplay of faith and reason.